Hi guys, it's Dave. Today we're going to talk about disease, and we actually had one of our followers request YouTube on, and that's CMV, or cytomegalovirus. It actually is related to the herpes virus, so similar to the viruses that cause chickenpox, cold sores that you can get, as well as mononucleosis. Now, in the general public, it is a very, very common virus. 10% of all babies will be born with this virus. 1 in 3 children will get this virus by the age of 5. 50% of all adults by the age of 40 will be infected with this virus, and 90% of all adults by the age of 80 will be infected with this virus. This virus has no cure, but there are several tips that can help you out to either prevent from getting the virus, or actually, if you have the virus, getting through it. Once you've been infected with this virus, you're infected for life. It does go inactive, but it can reactivate throughout your lifetime and cause problems depending on your immune system and severity. In most healthy adults, you don't even know you have it, and it will remain inactive in your body throughout your entire life. If you're a healthy person, the type of symptoms that you will see are fatigue, fever, headache, muscle aches and pains, and swollen glands. That is a majority of the things that you will see if you're healthy. You may also develop a sore throat. However, where the issue lies is in pregnant individuals that can then pass it on to their infants, as well as people with immunocompromised disease states, such as those with HIV, those with cancer, or those with organ transplants. These are the individuals that we really need to keep an eye on. If they develop CMV, it activates and can cause problems. In babies, the main thing that you're looking for, or that can occur with those, are, first off, you'll see premature birth. You'll see low birth weight. They can have issues with their muscles. They're not able to build a lot of muscle like normal. Their coordination can be off. There can be issues with their vision as well as hearing. And longer term, that's what can develop, is hearing loss is the main thing that you actually see with that. CMV is the #1 leading cause of infection-related birth defects in the United States. So if your baby does have CMV, you do want to keep an eye on them throughout their childhood to see if they have any issues with their vision as well as with their hearing. Hearing loss is the most major thing that you see with that. And if you catch some of the things earlier, it will help. You can do some things to help out. And not only that, you can help deal with the situation if it does progress. As far as immunocompromised individuals, these are the people that we really need to watch out for, because in this situation, CMV can be deadly. Things that can happen with that, you can see in these individuals, same things as with babies, but you can see vision loss, or at least issues with their vision. You can see pneumonia. Pneumonia can become fatal if not treated. You can see colitis. You can see esophagitis. You can see encephalitis, which also can become lethal as well as an infection of the brain. You can also see hepatitis, so it's very important that you're monitoring their liver function, and if they're on any medications that affect liver function, those are monitored as well. Like I said, once you're infected, you are infected for life. It can cycle, go inactive to activate, and go back and forth, and in most healthy individuals, it stays inactive. So, what are some things that you can do to help either prevent you from getting it, or to help so you're not spreading it if you're actually in an active state? First and foremost, it's kind of following it along the lines of a lot of the things we did with COVID, but wash your hands thoroughly and wash your hands many times throughout the day. Secondly, make sure that you clean countertops, especially in the bathroom, as well as toys. Third, make sure that you do not kiss children, especially if you're pregnant, on the lips or in areas where they have been crying. This disease is passed through fluids, so things like tears, saliva, blood, semen, and breast milk is how it's passed. So if you're in contact with those things, those are the things you need to try and avoid at all costs. If you're cleaning up and you have used Kleenexes, you have diapers, you have washcloths, be as careful as you can, wear gloves if you can, so you do not come in contact with those. If you do pick them up barehanded, make sure that you wash your hands thoroughly before doing anything else. Also, safe sex is very important. Make sure that you're using a condom. That also will help prevent the spread of CMV. If you do get it or it is active, it can take several weeks before it actually goes back to an inactive state. Again, you'll see a lot of fatigue, you can see fever. So what are some things you can do during that time? Build your immunity up. Make sure you're getting plenty of rest. Make sure that you're staying hydrated. Vitamin C, vitamin D, and zinc are a great idea. 500 milligrams of C, 50 milligrams of zinc, and 5,000 units of D are a great idea to take while you're in an active state. Once it goes inactive, remember it's going to be inactive in your body, but you are infected for life. Now, in babies and in those that are immunocompromised, providers will monitor them. If they seem to be going in the wrong direction that they want them to, there are some antivirals that they can use to help treat that. Ganciclovir and valganciclovir are two antivirals that they can use to help treat CMV. Now, there are a lot of side effects and a lot of drug interactions with those. So make sure that your provider knows everything you're on as well as your medical history before starting these. If they do start them, make sure that you take them exactly as directed. There are IV and oral forms of them, so you may have to go in for an infusion if you don't get the oral form. Make sure that you follow your protocol exactly as you're supposed to and continue through the whole course of treatment. That's the best outcome for you and those around you since you are a vector.